Delmarva Today with Don Rush.
The COVID-19 pandemic has highlighted the inequality of healthcare in the United States. Welcome to Delmarva Today. This is Don Rush. Deaths from the coronavirus has reached over 900,000 and continues to rise, even as the Omicron variant seems to have peaked. But at the height of the pandemic, the Black, Latinx, and Indigenous populations saw a death rate of 2.7% higher than the white community. But the disparities represent a much larger problem in healthcare for minority communities. Dayna Bowen Matthew is author of a new book entitled Just Health, Treating Structural Racism to Heal America. And her book takes a look at the underlying structures that have led to poor health outcomes, especially in the Black community. And we have her on the phone this morning. Welcome to the program.
Thank you so much, Don. I'm glad to be here.
So let's turn to the pandemic for a moment, because it seems to have revealed the kind of inequality, the kind of poor health care some communities get as opposed to other communities. Tell me a little bit about what you see on the landscape in terms of the pandemic and what it has revealed.
Your intro was exactly right, Don. It is no surprise to anybody who has been watching health inequality for the last decade or more that the inequalities that came to the fore from the health pandemic just reflect underlying inequalities in societal structures that have been historic for the past 400 years. So you are absolutely right that the inequitable access to health care was exhibited in the pandemic. So I like to say that white superiority showed its ugly face, not only in the disproportionate number of cases, deaths, and hospitalizations that Black, Native Americans, and Latino populations experienced, but also in the disproportionate access to the vaccine once it was made available. But that's just part of the story. That's just the healthcare disparities. The fact is that underrepresented minorities were exposed to this disease because they are housed in substandard housing, because they work in jobs that did not allow them to stay home and stay out of harm's way when the pandemic was raging, because they are subject to inequitable education systems, food security systems, criminal legal systems, and environmental systems that made them more vulnerable. You want to talk about comorbidities? It's the social comorbidities that this pandemic revealed.
Now, you opened your book with a discussion of your father as well as your mother, but your father in particular, who died relatively young, I suppose. Tell me a little bit about that and what you feel that represents in terms of the kind of health care and all those social factors that you point to played in his death.
For years, I thought my father's death at age 49 was because he was overweight, because he was stressed, and because he drank. It turns out that he did those things towards the end of his life. Those health behaviors were the result of the fact that his employment was unjust and unfair. And in order to get my brother and me out of the South Bronx, where we grew up, and into the position where I could talk to you today as dean of a law school, and my brother could have gotten an MBA and gone to Harvard, my father and mother had to work 5 jobs between them to earn a living wage. That's the structural racism that caused them to be obese and unhealthy. Those are the factors that really took their lives prematurely.
One of the things you point out, particularly about your father, is this kind of split approach to society. On the one hand, you describe him as being very outgoing within the African-American community with his family and so on, and yet when you saw him on the outside, dealing particularly with the white world, as it were, there was a much different persona. It's as if he lived in 2 different worlds.
That's one of the stresses of weathering life in America as an African-American male during the 40s, 50s, 60s, 70s, and 80s when he was in the prime of his life. So there is a researcher at Johns Hopkins. Her name is Erwin Geronimos, and she describes something called the weathering hypothesis, which is the example that you see in my father's life. Weathering means what one has to do in order to straddle 2 worlds, in order to make it in a society that is fundamentally structured for the benefit of one race over all others, and yet exist in that society successfully. So you're right. My father was bombastic at church. He was the life of the party in all family gatherings. But all of that had to tamp down in order to succeed in the predominantly white environments that allowed him to earn enough income in order to get my brother and me out of the South Bronx. Here's a story that I'll always remember, not fondly, but I remember one of my father's jobs was to be a superintendent. We used to call them supers in New York, the superintendent of a building. That means he collected rent, he was a handyman, he fixed the plumbing problems, answered emergency calls at night. He basically maintained the building. But in order to get equipment sold to him at a fair price, this man who put on a suit to go to work every day on the weekdays had to feign a white Jewish person's accent in order to order parts at a reasonable price on the weekends. So we would be sitting in the kitchen and listen to my father fake a Jewish accent, end a conversation when he was ordering parts to repair a building by saying he was going to send his boy over. And then my father, the deacon, the head of the trustee board, the head of a section of the Bowery Savings Bank's mortgage lending, residential mortgage lending department would shuffle on over to a hardware store and show up as the boy in order to get a decent price on his fourth or fifth job. That's demeaning. And weathering that kind of dichotomy takes its toll on your mental and physical health.
As a child, you witnessed this. What kind of reaction did you get? I mean, was this something that you just simply accepted? Was this something, a point of anguish? I mean, what sense do you get about what was going on there?
It depends on the age. When I was a teenager, I resented it greatly. When I got to be 20 and went to college and realized the systemic nature of the tragedy of what my parents had to endure, I became much more respectful. In many ways, writing this book pulled together all of my understanding of them and what they faced to succeed in a system of structural racism. So let me define structural racism, if I may, because the book is about the way that structural racism harms health, not only for blacks, Latinos, and Native Americans, but for whites as well. By structural racism, I simply mean that a historic system that hierarchically arranges people, inferior versus superior, powerful versus less powerful, valuable versus less valuable, creates a hierarchy of the value of people, and then in turn distributes all of society's resources, opportunities, power, and wealth according to those hierarchies. That's structural racism. And the point of the book and the point of my understanding of my parents' life is that they became the victims of this structural hierarchy that gave them inferior housing, employment, and health as a result of structural racism. Now I understand that, and I have tremendous respect for them.
In the book, you reach back to the beginning of the country, particularly Thomas Jefferson. Some quotes, by the way, quite surprised me, even though I know he owned slaves. He certainly did not view African Americans as equal to whites. But you talk about this idea of two things as a result. One is in terms of comparing them to animals. One is indifference and one is aggressive behavior. Describe a little about that origin that you certainly reach deeply into.
This is about dehumanization. Psychologically, that is the underlying foundation of structural racism. In order to believe and implement this heinous doctrine of white superiority that is given, operated life through structural racism, one has to convince oneself, whether consciously or unconsciously, in Thomas Jefferson's case, it was very much consciously, that the human beings that you are dealing with unjustly are actually not human beings at all. They have to be objectified. This is a process that social psychologists describe at length as dehumanization. It can be blatant and overt, as in the case of Thomas Jefferson, who would say they are not like us explicitly. My favorite quote from Notes on the State of Virginia is that their griefs are transient. Certainly you would have to believe that in order to impose the terrible grief of enslavement on a population of humans. You'd have to believe that they feel it differently than yourself in order to justify it. That's blatant dehumanization. But Thomas Jefferson's writings, and indeed so many of the instances of dehumanization today, evince not only blatant dehumanization, but also covert or subtle dehumanization. Think about the Flint water crisis. How could it be that a government could determine that a group of human beings do not need clean water to drink, can instead drink water that is putrid to the smell and obviously dirty to the eye, without assuming that the city's population that was 46% low income, below the poverty line, and over 40% African American, were somehow a little less human, a little different from the population that lives next door to you?
There are a couple of factors that seem to play into this kind of discrimination and ultimately leading to the healthcare issue. One is education. And we had for a long time segregation in this country, not only by law in the South, but certainly in the North as well, at least by de facto, if not by design. Tell me a little bit about the impact that has, particularly as it then relates to health care outcomes.
Thank you, Don, for this question, because it's one of the fundamental changes I would like to see in structural racism if we are to really make a lasting change in health disparities in the United States, and likely the world. Education and its attachment to, its relationship to health outcomes is very well explained in the academic literature, but not well understood in the policy world. Educational attainment equals good health, and the lack of educational attainment guarantees poor health outcomes. So changing the education system and the discrimination that is resulting from structural racism would make a huge difference in generations of health disparities. Here's what I mean. Right now, our education system is hugely discriminatory, not just because it is largely segregated, but even integrated schools get better funding, better courses, better teachers for white students than they do for underrepresented minority students. A recent study by Lauren Camera in 2019 showed that school districts where the majority of students are white receive $23 billion more than school districts where the majority of students are of color. This kind of disparity consigns populations from black and brown communities to poor jobs, poor housing, higher exposure to pollution, higher exposure to crime, and ultimately poor health outcomes for generations to come. Another part of education, if I may, just one more point.
Yeah, go ahead.
Is that, if I may, one other very important part of the educational disparities in the United States that have severe health outcomes is the disparity in discipline that is meted out for behavior of white students as compared to behavior of black students. This is the beginning of the school-to-prison pipeline, where black students are more frequently expelled, are more frequently suspended, and white students for similar behavior are more frequently sent to treatment for behavioral or mental health issues. Again, this is the beginning of the school-to-prison pipeline, and Don, the evidence is that begins in preschool at age 3.
One of the things that we're living through now is a backlash not only to the issue of how race is taught in public schools, but also we're seeing a number of school boards that have been taken over by conservatives who will probably be looking at reevaluating diversity programs as well. What do you make of where we are at this point? Because it does seem to be some progress being made on one hand. On the other hand, we're now getting this pushback that some of whatever progress we made might be lost.
Again, none of this is surprising. Many of us talk about this period in which we are living as the third Reconstruction. The first Reconstruction, of course, was immediately following the Civil War, and until 1877, major progress was made. Blacks were elected to Senate seats, to House of Representatives seats. That political power, that political equality resulted in policies that allowed black families to gain home ownership, to own land, to open banks, to open businesses. And the reaction was a fierce backlash in the early 1900s, led largely by the Ku Klux Klan and white superiority organizations. That was the beginning of segregation. Segregation actually had to be accomplished by law. Laws such as the one, I'll give you one example, in Charlottesville, Virginia, that literally had to separate whites and blacks on the same street and tell people based on their color where they could rent and where they couldn't, where they could buy homes and where they couldn't. That all had to be constructed by law. Fast forward to the civil rights movement immediately following the Jim Crow era. That period of civil rights legislation, the Voting Rights Act, the Fair Housing Act, the Civil Rights Act, Title 6 and 7 of 1965, 64, and all of the Medicare and Medicaid laws, that was a second Reconstruction. We are now in a period of a third Reconstruction where the backlash to the progress that has been made is fierce. I feel as though the legislation that's being passed to disenfranchise blacks around the country, to make it harder for poor people to vote, to make it harder for people of color to vote, is an effort to remove the progress and make sure that elections are won by making sure that people don't vote. This is no surprise.
One of the things that strikes me is when you're talking particularly about housing segregation, which was abetted by a whole host of agencies outside of simply the South, for example. One of the things that strikes me is that with the civil rights era, there was moving away from some of the African-American communities by people who made it economically. And I think it was Manny Marable who described this as sort of a hyper poverty left behind. What do you make of that in terms of, particularly in terms of healthcare, but this idea that on the one hand they ended segregation, on the other hand there was a lot of people got left behind?
There are two things that I would make of it. Let's first make sure that we don't have any mistake about the fact that segregation is not ended.
Right.
I'm this interview from Delaware, and the housing disparities in Delaware continue to be a civil rights issue at their core. Of Delaware's 12 census tracts with the highest risk of lead exposure, 9 are in majority black neighborhoods. So there are majority black neighborhoods, and the health conditions in those neighborhoods are those neighborhoods that are left behind, as you've described. The third Reconstruction must not leave people behind. All boats rise when the water level rises in education. All boats rise when health is improved from a racial standpoint for everyone. So let me just make this observation. Some of the concern about structural racism is being resisted because it is mistakenly perceived as something that will just help people who have been oppressed, help people from underrepresented groups. Well, certainly it will do that. But we should make no mistake about it. Structural racism kills everyone. It shortens everyone's life. Not only does the data show us that, for example, if you look at a county or a state where more people have searched for the word in Google or Twitter, you'll find higher infant mortality rates that affect blacks and whites. You'll find higher rates of death by heart attack for blacks and whites. But the COVID-19 scenario, pandemic scenario that you described in the beginning of this show, Don, is another great example. When we first encountered the pandemic, the hot spots were in largely urban black and brown neighborhoods, New York, Chicago, the Ninth Ward in Louisiana. And we ignored to our peril the fact that this disease knew no boundaries by socioeconomic status, knew no boundaries by race, and knew no boundaries by ethnicity. Certainly, there are disparities, such as you've described, in the way that this pandemic has manifested. But I would posit that our structural racist tendencies made us lackadaisical about a disease that has killed 900,000 people, regardless of race, color, national origin, or creed.
I believe in your book you describe this idea that not only is there a disparity in terms of economics, i.e., if you're living in a poor neighborhood, but even African Americans who make it, who, middle class, that kind of thing, you still see some disparity.
Without question. The paradigmatic example is the gap in infant mortality rates between black and white babies. So no matter what your income, I'm going to use the state of Colorado because I have that data most recently. No matter your income, if you are an African-American mother who is making middle-class salary, let's say between $50,000 and $75,000 a year, and you are college educated, you still have a 2.5 times higher likelihood of losing your baby in the first year of life than a mother who is white in Colorado, who is living below the poverty line in Colorado, and who has no more than an 8th grade education. So, quote-unquote, making it is no insulation against what I referred to earlier, the weathering hypothesis. That is, the stress and mental health challenges of doing what my father did, going between one world and another, navigating the microaggressions, accommodating the structural racism, and overcoming that in order to live the same American dream, to accept the same opportunities, to obtain the same opportunities for your children as would a white family. In this society, we see that the stress of being middle class in predominantly white institutions makes for even greater health disparities in some diseases like hypertension and heart disease than you see experienced by blacks who are not in the middle or upper class income levels.
I want to turn to the law because particularly with the civil rights era, we oftentimes turn to the Supreme Court to find equality before the law. But obviously that has changed over the years. Tell me a little bit about that, particularly the disparate rule, which now seems to gone out the window. Describe for that. I mean, because a lot of folks have looked to the courts in particular, but now we have a very conservative Supreme Court, and we certainly have a lot of conservative judges on the federal bench.
We in the African American community have had to rely on different levels and branches of government over the course of our history. And it is not always the case that we can rely on the United States Supreme Court. We know that there were points in history, Plessy versus Ferguson is an example, when the Supreme Court got it absolutely wrong, when the Supreme Court was complicit in the erroneous perception and institutionalizing the erroneous idea that blacks could be owned as property and were not human beings. We might be returning to an era when that is true, as this court faces issues of affirmative action, of criminal justice reform, of voting rights. And we may have to turn to other branches of government to secure the rights that are justly and equally obtained by all human beings in the United States. It was the legislature, Congress, that took the lead during the civil rights period and during Reconstruction. And it was making sure that we had the vote, that we exercised our franchise, that we were active at the school board and at the city council level in order to make public health, education, and environmental law decisions that advance civil rights and equality in our communities. We may, for a period, be returning to those venues until we are successful enough to change the composition of the Supreme Court of the United States.
Justice Roberts has talked about being colorblind as opposed to what I think are remedies for racism. What about that phrase? And how is it, because it seems to me that in some ways it's deceptive because you have to have remedies for the racism and the structural racism, matter of fact, you refer to deal with those inequalities, while at the same time may look to someone else, particularly I guess someone who's white, as not being colorblind. Tell me a little bit about that concept there. And there seems to be certain conflicting ideas going on there.
I like the word that you use, conflicting. The concept of colorblindness has such appeal, at least to the ear at first. Indeed, The case that it came from was a dissent by Justice Harlan, in which he said the Constitution is colorblind, and that sounds so lofty, we don't see color. Here's the problem. We can't pretend not to see color when the rest of society sees color and indeed organizes access to housing, education, clean air, clean water, food, every social determinant of health by seeing color. Becoming magically colorblind at the stage at which we try to correct those inequalities is foolhardy. And so the concept of colorblindness is not just conflicting, I think it is disingenuous. One of the things that I say in the book is something I got from a very wise African-American pastor that I met in Charlottesville, Virginia. And he gave this analogy. If you steal my bicycle when I am a young kid and then hold on to it while you advance from a bicycle to a motorcycle to a car to a boat to an airplane, and then at the end of my adulthood hand me back my bicycle and say, now things are equal, go forth and conquer, what you have done is nothing short of perpetuated the aggregate inequalities. And that's the idea that I see colorblindness manifesting. It's just ignoring the aggregate inequality of policies that were anything but colorblind and only raising this, what I consider to be, Pollyanna notion of colorblindness at the stage when we're looking to correct all of the inequalities that preceded.
I want to turn to the medical profession because you point out that African Americans, maybe particularly African American women, they tend to be treated differently than, say, white patients, for example. Tell me a little bit about that. Give me an example of that, because I think most people, certainly in the white community, go about their daily lives without making any assumption about that at all.
This is, again, more example of what it means to weather life in America as an African-American person. When that racial status is combined with your gender, African-American women, this is a phrase coined by Kimberly Crenshaw, the great Kimberly Crenshaw, African-American women experience a double dose of discrimination. We call it intersectionality. No one is just their race, just their ethnicity, just their national origin. They are a black woman from the Caribbean, or a black woman who works in XYZ job. In other words, there are many parts of our identity that intersect with one another. That intersectionality combines in a unique way when African-American women encounter the medical system, also the criminal justice system, but the medical system that you've asked me about. We have studies that show us from recording video encounters of clinical interactions between physicians or other clinicians and their patients, that when physicians encounter women who are black and they are not, their body language changes. The length of the clinical encounter changes. Their eye contact is less. They are less tolerant of the verbal communication from women and become dominant in the conversation. In other words, the unconscious differences that providers see when they see a black woman who is unfamiliar, who is new to them, and who is only a caricature because of our segregated education and housing systems, their entire interaction unconsciously changes. Now that, it turns out, affects more than just the good or bad feelings from the clinical encounter. We already know that patient satisfaction for black women goes down after these types of encounters. But it goes further than that, Don. We have studies that show us that treatment decisions are different based on presumptions and assumptions and perceptions of black women that are simply inaccurate. One of the studies that is showing this most powerfully is a research project that was done at the University of Virginia. Their medical students were asked a series of statements They were asked their agreement with a series of statements, some of which were true and some of which were blatantly untrue. And the statements were about how blacks and whites feel pain differentially. So there were statements that were untrue, like blacks don't feel pain as frequently or as easily as whites because their skin is thicker. This is empirically untrue. Because their blood clots more quickly. This is empirically untrue. Because their bone density is greater. This is empirically untrue, and so forth. So you see? And what these researchers found was that the more of these incorrect statements, incorrect perceptions of blacks versus whites and how they felt pain, that third-year medical students believed, the less likely they were to treat pain complaints of black men and women equally to the way that they would treat them for whites. So your perceptions as a physician of black men and black women can change whether those patients get the correct treatment of choice or something inferior.
We've been speaking with Dayna Bowen Matthew, who is an author of a new book entitled Just Health, Treating Structural Racism to Heal America. We appreciate you taking the time to talk to us. This has been Delmarva Today. I'm Don Rush. Thanks for listening.
Delmarva Today with Don Rush.